Now let's consider the anatomy as it changes through the lifespan. The infant anatomy is obviously smaller altogether, but the biggest thing is the size of the oral cavity. So it's a very small oral cavity with respect to the size of the head. And the reason there's such a small oral space is that you have this rather large tongue, this oversized tongue, and then within the buccal cavities you have these sucking pads. And the sucking pads will stay there. These are compacted masses of fat within the masseter muscle, and they'll stay there, as long as they're stimulated. So sometimes in thumb suckers, you'll see sucking pads living a little longer than you should. But in an average child, around 6 months, you'll start seeing those sucking pads get reabsorbed and disappear. Also, kids have a small mandible, so the mandible leans back a little bit. And again, this facilitates better sucking because it allows closer approximation of the lips to the nipple. The hyoid and larynx sit high in the neck relative to the adult, and the approximation of the velum and the epiglottis occurs in the infant. That does not occur in the adult. This is kind of nice because it provides a little bit of a posterior wall to prevent leakage into the pharynx until you're ready for it. As you get older, the oral cavity gets larger. There's no more fat pads. The larynx and the hyoid descend, and the pharynx elongates. And here's a schematic comparing these 6 sites, and you can see how compressed they are in the little guy and how much more expanded they are in the adult. On the other end of the age spectrum, we have the geriatric folks, and we see some changes associated with advanced aging as well. And obviously one is reduced dentition, ossification of the cartilage, so the cartilage becomes more bone-like and therefore becomes heavier and increases the mass of the larynx. And remember, we have to use these floor of the mouth muscles to lift the larynx up. So the larynx is now heavier and takes a little bit more muscle work to pull up. And this happens at the same time that muscle fibers are atrophying with age. The larynx descends further, and also there's arthritis can set in. And if you have arthritis in those laryngeal joints, you can have some poor airway protection. It's also possible that with arthritis you'll get cervical vertebrae that impinge into the pharyngeal space and cause some limitations there.